Knowing that real-world access to GLP-1 medications can be a challenge, we sought to use data from our proprietary commercially available obesity and overweight care program to assess that access and its associated outcomes. We were able to look at about 6,400 patients who'd finished 1 year in the program, and then a subset of about 1,500 of those who'd completed 2 years in the program. So we looked at disruptions in coverage, outcomes by how many fills they got, and then just kind of assess that also across glycemic category and intake. So we found that on average in the first year of the program, patients were receiving about 8 fills. That subset that went on to complete 2 years in the program received 15, so less than perfect access. As far as coverage gaps, what we found was the majority of the cohort had a coverage gap. About 72.5% had a gap in coverage equal to at least 13 weeks of not having a fill on their medication. However, we did find that those people who had that coverage gap still had clinically significant weight change. We found that they had about 13.7% at 12 months and 14.9% at 2 months. We will note that those people who did not have that coverage disruption had better outcomes, about 17% at 12 months and 20% at 24 months. Finally, we found that patients who had only 1 to 4 GLP-1 fills in that first program year, they still lost a little bit more than 10% of their body weight. So they were still achieving that clinically significant weight change. In the last few years, we know that we've faced a lot of supply challenges. We also faced insurance and access challenges, and then there's the medication adherence challenge on top of that to boot. We hope that these results can really be heartening and can show that even in situations where there are coverage gaps, where there's that less than perfect access, that patients can still achieve that clinically significant weight loss. And we do also believe that this suggests that really you want to pair those drugs thoughtfully with a change, with a program like ours, which combines intensive lifestyle change with health coaching. Really give the patients the support they need as they embark on that even more further challenge of long-term behavioral change.